Hey, this is Different Careers with Kate Nudd. Today I'm going to review another funky necks, TOS, and arm pain continuing education course for licensed massage therapists. This is certified in New York State. It was worth 1 hour. The instructor was Eric Dalton. So let's get into this thing. So trying to figure out what's causing a client's neck and arm pain can be challenging. It is a nerve problem. Tendinopathy, thoracic outlet syndrome, muscle strain, ligament injury, protective spasms, sensitization, pathology, or even chronic stress. In this course, Eric Dalton takes you on a clinical reasoning tour to help uncover the mystery pain generator and demonstrates myoskeletal techniques he's found helpful in treating these conditions. Special video animation and anatomy dissection and dozens of skill-boosting hands-on techniques make this an entertaining practical learning experience. So this course was featured during the 2021 APM CE Summit. So course outline, introduction to pain, cervical spine anatomy, and then he goes over all these things. Learning objectives. Having viewed this online massage therapy technique CE course, participants will be able to identify the anatomy of the cervical spine, list at least 2 assessment tests for cervical neck pain, list at least 2 massage therapy techniques for cervical spine, list the muscles involved in thoracic outlet syndrome, list 1 assessment test for thoracic outlet syndrome, list at least 2 massage therapy techniques for a client with thoracic outlet syndrome, list at least 5 massage therapy techniques for upper extremity nerves. So here is Eric Dalton's background. He is a renowned myoskeletal therapist. Eric Dalton, Ph.D., shares a broad therapeutic background in massage, rolfing, and manipulative osteopathy. In his entertaining, innovative pain management workshops, books, videos, Dalton is executive director of Freedom from Pain Institute, developer of myoskeletal alignment techniques, and author of Dynamic Body, Exploring Form, Expanding Function. www.ericdalton.com to read Dalton's internally published articles and find information about his workshops. And the hands-on massage to address clients' neck pain and the thoracic outlet syndrome. This course includes special video animation. Yeah, I don't know why they're putting that again. So the review. So this took me over 1 hour and 30 minutes to do. I did think it had a lot of good information in it. But after I finished the course, I tried to pass the quiz the first time around, and I failed it, and I passed it the second time around. So that means to me his material went over my head. It needed to be taught to me at a slower pace. I needed to be in a classroom to be able to learn these techniques as a licensed massage therapist. And to me, because he was focusing more on nerves, to me, it seemed like he was coming from the osteopathy PhD perspective, where it's like he went to school, got a doctorate to actually be able to treat the nerves. So he was focusing more on treating the nerves than treating the muscles, because from my understanding in New York State, to be under the scope of practice, to help people with these different conditions, you have to treat it from a muscle oriented perspective. Where, for instance, if you are having nerve problems, you need to see an osteopathy or a chiropractor because they have the license to treat the nerves. I do not. I have the license to help loosen up muscle tension. So if muscles are so tight that it's pressing on the nerves, then I can massage the muscles to help free up the nerves. But I am like treating nerves is out of the scope of practice for a licensed massage therapist. So a lot of the techniques of like, these are the techniques I have found to help free up the nerves and the necks and stuff like that. It seemed like a chiropractor should use those techniques, or an osteopathy Ph.D. doctor should use those techniques. Like, unless you actually learn the techniques hands-on, I do not feel comfortable using any of this material in my own practice. Like if I own my own business or even in a spa setting, I'm going to recommend someone go see an osteopathy, or however you pronounce the proper terminology. How do you pronounce it? Like osteopathy doctor or a chiropractor. You want to go to them because they learn this thoroughly in school. So let us like watch maybe like a few minutes of this and see. Ooh, hey, what are you doing? It's not what I wanted to do. Okay. So, okay. I liked the introduction. So let's walk. So what I got from this video is I think he's from Oklahoma. In the description, it did not say that he was from Oklahoma, but he was like what a good illustration of like using rodeo would be like people who do hardcore sports. If you like hurt yourself, like, hey, like come see us osteopathies or chiropractors or massage therapists. Like, hey, that's a good way to advertise. Like if you're roughing it, uh, come see your massage therapist. Come see your osteopathy or your chiropractors, because you need to get your spine aligned, you need your muscles massaged, and you need to correct your alignment. So I thought that was like that made it a little bit interesting, and he put music in the video. So I was like he like made the video like more interesting by doing that. Okay, let's see. So okay.
Look at cervical spine anatomy and try to identify some possible pain generators. So we have all the nerve roots coming in and out and down, spinal cord, going up to the brain. I'm going to kill this here. We're taking a C23 here and looking at this. It's important to understand the anterior and posterior roots. The anterior roots are the motor nerve roots. The posterior are the sensory nerve roots. So the posterior are the sensory, and they transmit and receive information about body sensation, whereas the anterior roots are motor neurons that supply information about moving our bodies in space. And here's where we get into some of the things that we're going to be dealing with today. They're intervertebral foramina, where the nerve comes out. The nerve root comes out. Can be a nice big space like that, but often it's not. Often it's encroached by bone spurs or osteophytes. Let's take a look at that. These are the dermatomes. Let's talk about that first. These dermatomes have not proven to be exact, so we just get a general idea of dermatomes. C3 dermatome typically is going to be in this area here. C3 can come down. It can be the lateral neck flexors. C4 innervation is going to be a little bit lower. You see the deltoids in there. C4 can be levator scapula upper trapezius. And 5 can be down on the arm lines, down on the triceps, deltoids, also biceps, all the way down, and the diaphragm. Okay, we got to keep that in mind. So when we look at these intervertebral foramen and the nerve roots, we can see that a disc herniation can sometimes go in and kind of start rubbing or completely compress or occlude the nerve root as it's leaving the spine. And then we've got that as a possible problem, which is facet joint osteoarthritis. When they talk about bone spurs, they're not talking about real spurs. They're not spurry. They're little round bumps. So they're not necessarily a bad thing. You can have an osteoarthritic neck completely full of osteophytes and bone spurs and have no pain at all. But when they start to encroach on the cervical nerve roots as they leave the spine, then it starts to fill up that intervertebral foramina and can start to break down the axon. So this is the first place. That's why we're starting proximally in our investigation into arm pain.
So he went over like a bunch of different problems, and like what is the solution to it. Let's see here. And again, like going over like how to address the nerves and stuff like that. So let me see if I can find some of like, maybe it's over here. He did a lot of stuff, so. Oh.
When they have the tendinopathies, what is the muscle that's typically the first to tear, causing tennis elbow? Extensor carpi radialis brevis. That's the shortest of the three. It's the one that tears away the most. So it's also one that I find is more painful about 3 inches down from the elbow. That's where, if you compress it, that's where you really feel the pain, if it's that. So here's what I'm doing here. Notice I just have a compressive force, light compressive force, tapping on that area at the lateral epicondyle, and then extending. Notice how I'm also internally rotating that wrist to exasperate the symptoms, and a little bit of ulnar deviation, but not much in that wrist. Now let me see what we got going on here. This is the median nerve, carpal tunnel nerve. So carpal tunnel one is actually the easiest of all. You just externally rotate the arm. What fingers do you have to push back? Thumb, index finger, middle finger. Then you're going to do what? Tap on the transverse carpal ligament. That's the area of the carpal tunnel. I also like to tap on into the palm too, because sometimes that's where they will get the sensation and not right under the transverse carpal ligament. Just know that a lot of carpal tunnel syndromes have nothing to do with this tunnel, or at least nothing to do with the transverse carpal ligament. It can be the lunate bone, the hamate can be a problem. Those bones in the carpals can come in there and crowd out the nerves and as they go through the carpal tunnel. So there are a lot of different things that can cause that. So basically it's just a simple tapping. Now we're going over to Guyon's tunnel where we were talking about. Here's what it looks like. It's got a little bit of a piece of a ligament over it, and when it gets trapped, where are you going to have the pain? Little finger, ring finger, maybe a little bit in the middle finger, but not much. So you just do a little bit of tapping over there. Tap, 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 and check in with your client patient.
So tapping is one of the things that I did learn as a massage therapist in massage therapy school. So that is something that we licensed massage therapists can do. But again, like I am not I do not have the license to treat the nerves. I can massage and do different massage techniques to help the body as a whole and the muscles as a whole. And some of those techniques might be able to help the nerves, but I'm not going to be like treating the nerves because that's out of my scope of practice, because like you would need thorough nerve training. So I really felt like overall this video was more like a summary of, hey, if you come to one of my schools or training seminars, then I can teach you how to do all these techniques thoroughly. Um, so, um, um, but it sounds like this is something you could do, probably learn as osteopathy or even maybe a chiropractor, because they learn different techniques in chiropractor school or osteopathy school. So, but I would typically feel way more like right now for my skill level, I'd be like, this is out of my scope of practice. I would want hands-on training and like certification of being like proof that I thoroughly went through all these classes to be able to do this in my practice if I did use like some of these different techniques. So let's go over a little bit of
the nerve, strengthen it, tighten it and loosen it, tighten it and loosen it, tuck in the interstitial fluids around the nerve, stuff like that. Here's the home retraining. It's a simple one called the waiter's tip. You actually internally rotate the arm, have that thumb grasp with your fingers, and you just lean your head away and abduct your arm away from the body to your pain threshold barrier, and then you could just go back and forth, flossing back and forth, back and forth.
Again, as a licensed massage therapist, we are trained to do assisted stretching. So if I were to get trained to thoroughly stretch people in this way, and it was like repetitive enough where I felt comfortable doing it on my own and it became second nature, then I would probably feel comfortable doing these techniques. But just watching this video briefly, like to me, this video was more a summary of like, this is like possible things that you could do. You need to get more thorough training to apply these in your practice, unless you have more understandings of like, if you are a licensed massage therapist, have you done certification to be like, I want to learn thorough, or I want advanced training in how to do body work stretches and stuff like that. Are you going to get like bodywork stretch provider certification to be able to thoroughly do a bunch of different kinds of stretches? Because like sometimes you might need to do something else where it's like, I need a more thorough class. And I'm the type of person, I am a hands-on learner. It's very hard for me to learn something just from watching a video, especially if they're going through things really, really fast. So, like, for me personally, I gave this class a F because it took over an hour. I failed the quiz the first time. Certain things and concepts went over my head. I didn't understand the actions and everything. I couldn't just remember everything he was telling me. It was like I had to take a test at the end, and I'm just like, this is just supposed to be a continuing education course, and I'm supposed to be able to get the information the first time I watch it, maybe take some brief notes, and be able to pass the quiz at the end. Like, I'm not taking your course thoroughly. So that's why I gave him an F, because this is just to educate me a little bit more to keep my massage therapy license current. I'm not paying to actually thoroughly learn these techniques. So it's like I do not feel comfortable applying any of these techniques in a spa setting, or even if I did my own business, a personal business professional massage therapy private practice where just from watching this video, like, my assessment is you have to get hands-on training to do this properly, because when you're dealing with nerves, you could mess someone up if you don't like stretch them the right way, because he was showing some techniques where you were pressing down on the clavicle and stuff like that, and like make sure you don't like overstretch them to pop their joint out and stuff like that. So I was like, no, 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 out of scope of practice. Just by watching this video, like, I would not feel comfortable applying any of these techniques um to in my practice. And one of the techniques he showed, like, I tried to do it on myself, and then I realized, oh, I was doing it the wrong way. And I was like, well, it would help me get into a certain muscle easier, but he was showing it the other way, and I tried doing it on myself, and I was like, that's completely uncomfortable. People usually come for a massage in a spa setting for relaxation and some deep tissue work where you're getting into the deeper layers of the muscle to release certain muscles. But you don't, unless people are saying they have certain problems, I'm just like, yeah, I probably wouldn't do that because it doesn't even feel comfortable on me. So, that is my review. Like, I really am tired of giving people Fs. I wish someone would create a class where it's like, this class is designed for continuing education credits at home online. This is the purpose of this class, is so you can get your continuing education credits at home and apply some of these skills into your own massage therapy work wherever you work. But apparently, I guess people aren't doing that. They're more summarizing what they do, like, so that way you can pay to go to these summits face to face and like take the classes there. So, thank you for watching this video. If you have any massage therapy questions, feel free to put that in the comment section below. Until next time.